I'm Quinn Watercutter.
And I'm Neha Jasti, and we're both students from Centerville High School, and today we're going to focus on cardiovascular surgeons.
In our freshman year bio class, Neha and I had a case study that dealt with a patient that had numerous heart issues. After further investigating the case study, we were able to look into the field of cardiovascular surgery. As with driven students and athletes, we identify with many of the personality traits of a cardiovascular surgeon, including competitiveness, good time management skills, and a strong work ethic.
Other characteristics that cardiovascular surgeons possess are being able to communicate well with their peers and colleagues, but most importantly, their patients. They also have to be able to deal with a lot of pressure, for the life of the patient is in their hands. They have to be good thinkers and quick on their feet. Lastly, they have to be able to stand on their feet for a long duration of time during surgery, similar to how student athletes have to be fit in order to play long hours during their games.
They'll need to work these long hours as they have many job responsibilities. First, they'll have to operate on the heart and blood vessels if there's any damage caused by accidents or diseases. Then, they'll have to track any surgical care, including pre-op and post-op care. They'll have to talk to the patient and the healthcare team, which includes primary care physicians, cardiologists, and other surgeons. Lastly, they'll have the opportunity to research the heart and blood vessels.
This focus of the heart and blood vessels is demonstrated on our poster. As you can see, there's red and blue string that extends out, similar to how veins and arteries extend out from our heart to the rest of our body, fueling our life functions. This emphasizes how important the field of cardiovascular surgery is, for it deals with the preservation and treatment of a very important organ, the heart.
To be able to care for this vital organ, you'll need extensive training. It takes about 14 to 16 years to become a fully certified and licensed cardiovascular surgeon. First, you'll need a bachelor's degree, commonly in a STEM major such as biology or chemistry. You'll then need to take the MCAT, which is the Medical College Admissions Test to gain admission into medical school. After 4 to 5 years of medical school, you'll go into a residency program for 4 to 5 years in either internal medicine or surgery. You'll then enter into a fellowship for 2 to 3 years, where you'll be able to take the American Board of Medical Licensing exam to become a fully certified and practicing cardiovascular surgeon.
A practicing cardiovascular surgeon makes an average about $420,000 annually in the United States, more specifically around $202 an hour. However, salaries can vary depending on how a surgeon wants to further their career, whether that be with teaching, where they can help newer generation surgeons learn, especially with their extensive knowledge and experience in the field. However, they will experience a decrease in pay, or they can open up a private practice where their pay will increase, but they have to deal with the difficulties that come with the administration process, financial and legal paperwork, and also managing the facility as a whole.
While the field of cardiovascular surgery is very rewarding, there are some difficulties that come with it. First is cost. It costs a lot of money to go to medical school, and many surgeons go into debt because of this. Secondly, it takes a lot of time and energy to work this field. First, you'll have a lot of people depending on you for your job, and the hours for this are long and hard. You'll have to be the bearer of bad news, as there may be difficulties on the operating table, and you'll need to relay this information to the patient and their loved ones. You'll also have to deal with medical malpractice, and the insurance rates for this can be high. It's a very high-pressure field, and it can be stressful at times.
However, there are many benefits to becoming a cardiovascular surgeon. One, as mentioned before, salary. With the salary that this specific surgeon makes, you're going to be able to live a quality life with no financial worries. 2, job growth. Job growth has increased by 24% for surgeons in 2020. And with our aging population facing both obesity and heart problems, the need for cardiovascular surgeons is at a high. 3rd, simply helping others. Saving a life or improving the quality of someone's life brings personal joy. Lastly, technology. Surgeons have been able to improve their techniques and increase their success rates with the new advancements in equipment that have welcomed into the field.
The new improved technology for this example is robotic heart surgery. First, the percutaneous aortic heart valve replacement is a common procedure for this, which is essentially a heart valve replacement but through a blood vessel. It does not require open heart surgery, and it takes less time. Surgeons will operate a large surgical device using a console similar to this. Like a video game, they'll be able to manipulate the figure to be able to perform the surgery, which involves less stitching, less cuts, more precise cuts, and also it takes less time. The surgeries for this are typically used for younger and healthier patients, but it soon could become the driving force in the field of cardiovascular surgery.
Thank you for listening to our presentation on cardiovascular surgeons.